Good afternoon and thanks for joining us. I'm Judy Simpson. The month of May is Older Americans Month. So today we're going to highlight the important roles that senior Vermonters play in our state and spotlight some of the key services available to them. Joining me are two guests from the Vermont Department of Disabilities, Aging and Independent Living. Monica Hutt is the Department Commissioner and Megan Tierney Ward is the Director of the Department's Adult Services Division. Thanks so much for coming in to see us today.
Thanks for having us.
Let's start out with a quick demographic snapshot of aging in Vermont. Commissioner Hutt, is it true that we have one of the oldest populations and that Vermont is a good place to grow old?
Absolutely. We definitely have one of the oldest populations in the country. Right now, Vermont is the oldest state right behind Maine. But by 2032, we will be number one. We'll be the oldest state in the nation for individuals 65 and older. In terms of growing old, I think Vermont is absolutely one of the best states in the nation in which to grow old. Just this year, we were voted the healthiest state in the nation for seniors by the United Health Foundation. And our long-term system, our services and supports for long-term care, were ranked 6th by the AARP.
That's pretty impressive.
It is pretty impressive.
So can you talk a little bit about the Older Americans Act and what role it plays in the lives of older Vermonters?
Absolutely. The Older Americans Act was first passed in 1965 by Congress, and initially it was focused on social services for older Americans. But as the years went on and as needs changed, it really shifted to become an act that was focused on health and well-being for older Americans. Vermont receives right now about $6.4 million from the federal government, from the Administration of Community Living, and contributes itself about $4.6 million towards the services and supports that are part of our mandate through the Older Americans Act. The primary partner for us in the community for Older Americans Act services are the AAAs, the Area Agencies on Aging, and they provide a multitude of services on the ground in communities for older Vermonters. Things like nutrition, information and assistance, options counseling, case management if individuals happen to be in our long-term services system, abuse prevention, health and wellness programs. You hear about a lot of fall-related programs, programs that are designed to help people avoid falls, to stay flexible and healthy. A lot of our congregate meals and home-delivered meals happen all through the AAAs. They reach about 60,000 Vermonters annually.
It's a lot of people.
It's about 10% of our population, so
yes.
It's a really significant number and speaks to that demographic that we talked about earlier.
Now, President Obama recently signed a reauthorization of the Older Americans Act. Megan, can we expect to see some changes in Vermont related to that?
Sure. Well, you're right. It was just reauthorized, and we're happy to say our Vermont congressional delegates really helped us quite a bit to have that passed through 2019. And what that does for us is it really assures that our core services will continue in Vermont, and that's very reassuring to us. But it also increased the budget about 7% nationally. So we do expect to see hopefully a small percentage of that for our share in Vermont. And we expect that that might have a focus on nutrition services and perhaps some legal services as well, or elder justice services in Vermont.
And so as I mentioned at the beginning of the program, May is Older Americans Month, and the theme of the month nationally is Blaze a Trail. Monica, what does that mean to you, and how do you see Vermont fitting into that picture?
I love that theme. I really am. I'm just so excited about it. I think that nationally, when they're talking about blazing the trail, they're really talking about seniors advocating for themselves and participating in communities. For Vermont, I think it's this amazing opportunity to really reframe the narrative and the story around our seniors. This revelation that I had recently was that we are actually all aging. So blazing a trail means really trying to create the community that we want to see for ourselves, the community that seniors want to see for themselves, and being a senior, an older Vermonter today is very different than it was 10 years ago. What our expectations are for the life that we're going to lead, what our expectations are for participation in our community, that's all really changed. So blazing a trail is charting a new course forward, making sure that people are checking off their bucket list and engaged in civic responsibility. There's so much more caregiving, get grandparents connected with their grandchildren, and opportunities for, we've been calling them encore careers. You know, as our demographic changes, we have to recognize that our seniors really are the repository for business acumen and experience and information, and we have to tap back into them to really make sure that Vermont's meeting its employers' needs as we move forward.
It's interesting because if you think of your parents' generation, it was, you know, you make it to 65 as a milestone, then you retire, and then you're supposed to just enjoy your golden years.
Right.
But it's totally changed now. I mean, people
totally
probably won't be retiring at 65 and want to continue to work and want to continue to be vibrant and be part of the community.
Yeah, I mean, I think the ability to keep people healthy and our focus on healthy aging, particularly in Vermont, people are living longer, they're living well, and we have to change the story a little bit because nobody's sitting in a rocking chair anymore. They're out and about, and we want to be out and about.
Right.
So.
And so, Megan, tell me a little bit about the network of community providers that are gearing toward opportunities and supports and services for older Vermonters.
Sure. As Monica mentioned, our core Older Americans Act services are through our local area agencies on aging, and there's 5 of them in Vermont. Those agencies are also what we call Aging and Disabilities Resource Connections, or ADRCs, and it's considered a no wrong door place that people can go, and that means that not only can they help with volunteer opportunities, how to get connected with work, like through the Senior Companion Program or the Senior Community Service Employment Program and the work they do with RSVP, the Retired Senior Volunteer Program. So active folks can be connected in that way, but they also are that connection to other providers in the community. So there's a vast variety of connections they can help people make to services that provide more for people to stay in their communities, like through our local home health agencies, adult day providers, senior centers, even hospitals and residential care homes and nursing homes where people may need more services. But they also connect with other health and wellness, like a SASH program, which is support and services at home for people who have Medicare. So those are those health and wellness services that keep people healthy and in their communities. So it's almost endless, the types of connections that could be made for people who contact the area agencies on aging.
Well, it's amazing just how many things there are available, whether you just need a little bit of help or even a lot of help. And so, Monica, tell us how the Department of Disabilities, Aging and Independent Living helps older Vermonters, not just in Older Americans Month, but year-round.
So DALE is the acronym that we use. It's a mouthful otherwise. It's a big name for a big department. DALE is one of the 6 departments of the Agency for Human Services. And our mission statement is to make Vermont the best state to grow old or live with a disability with dignity, respect, independence, and I would add choice to that. We're very focused on making sure that people make choices. Our services are pretty expansive. It's a big department. We oversee Medicaid-funded long-term services and supports for adults with physical disabilities and who are aging, who want to live in their own communities, licensure and quality oversight for nursing homes and residential facilities. We run the Adult Protective Services, so if there is a suspicion of abuse, neglect, or exploitation for a vulnerable Vermonter, we are the call-in line and the investigative function. Public guardians for adults with disabilities, and again, older Vermonters. Lots of work with employment, both through vocational rehabilitation and the Division for the Blind and Visually Impaired. So getting people back to work, getting people to work who want to be working in part of the workforce. Independence supports for individuals who are visually impaired. So many other programs, and frankly, we couldn't do the work that we do excuse me, on behalf of older Vermonters without our partnership with the Agency of Human Services and our sister departments. So the 3 Squares program, which is a food stamp program, physical and mental health services through our departments of health and departments of mental health. It's really a nice partnership in the agency on behalf of older Vermonters.
And so, Megan, Monica mentioned nutrition services as part of the core of the Older Americans Act. Talk a little bit about home-delivered meals and congregate meals in Vermont, because that is a huge issue for a lot of folks who are maybe even at home and feel kind of isolated, can't really get out.
Sure. So Vermont has a state plan on aging, and really food security is really a big part of that. Right. And so in Vermont, most of our nutrition services are through the Area Agency on Aging, again, quite a theme, but we serve almost 5,000 people a day with a meal throughout the state. And at congregate meals, about 11,000 people. So it's a lot of people. What's nice about the home-delivered meals and congregate meals is that there is no income test. There's no asset test. People can get those services. And they're encouraged to make a donation if they're able. But people should not be afraid to reach out and ask about those services. What's also interesting is for home-delivered meals, or Meals on Wheels as people know it, 5,000 people, like I said, every day get a meal, but a third of those people are 85 or older. Wow. And about half of those live alone. So that home-delivered meal is not just nutrition and a meal, it's also somebody coming into the home and checking on somebody as well. And so that's in it. I've heard many stories about people getting just that friendly service, but also checking on them to make sure people are safe.
Yeah, they're really the eyes on the community to a certain extent.
Exactly. Sometimes the only eyes.
Okay, well, Megan, in the past, if you were an older adult and became ill or unable to care for yourself, it seems that the nursing home was the only option, but that's really changing.
Right. So in Vermont, we're really proud that we have a program called Choices for Care, and that started in 2005. And what that did is it kind of leveled the playing field. It allowed people to make a choice between nursing home or home and community-based services where they wanted to get those services. We know that the vast majority of people would prefer to get their services at home or in their communities.
Right.
And it's a Medicaid-funded service that helps people. And what's great is today we're up more than 50% of people on that program get their services in the home-based setting or in their communities. So we're really proud of that fact. And it's great because it's shifting that balance, but it also still allows people to make that choice between
What kind of services are we talking about? Can you give me some examples?
Sure. So folks who are in their own home can receive services through their local community providers like home health services. They can go out to an adult day provider where they have a meal and social services as well and respite. People also have the option to self-hire their care in their own homes. So there's an option for some people to be able to hire family members or people they know to do the care. And then folks who choose to live in kind of a 24-hour setting can go to a licensed residential care home or assisted living residence, and again in a nursing facility where they get kind of the highest level of assistance that somebody might want or need.
And so it seems like for an older population, sometimes it's hard to ask for help, sometimes it's hard to admit that you need help. Yes. Is that something that you work with?
Yes, I know our provider network does a lot. I think Vermonters especially, are very proud of their independence. And it's nice because our case managers and our provider networks are very skilled at working with people to develop their options, but look at what that individual's goals are. So there's no right or wrong answer. And eventually if it's services that they want or need in their community, that's what they'll get help with. But we do have a tradition of respecting folks' wishes and desires, so we work with them.
Well, Monica, are there any areas related to aging in Vermont where we need to focus or improve?
Yes, and I'm glad that you asked that. As much as we are celebrating Older Americans Month, I think that there really is work that we want to do on behalf of Vermont seniors as we move forward. And I think that there are probably 3 areas in particular that are spots where we're higher than the national average and are not as comfortable and really want to focus and work, especially as we think about trying to improve what we're doing. So chronic drinking in Vermont is much higher than the national average, and starting with 1 as the best in the nation, we're 35th in the nation for our chronic drinking among older Vermonters. And especially when it comes to individuals not recognizing the kind of interactions that alcohol may have with prescription medication, needing to change as our bodies change, needing to change our habits a little bit. And so it's a place where we're really trying to do some education and some outreach and some focus. We also have a very high prevalence of falls and fall-related injuries, again, 43rd in the nation. So some place where we want to do some focus. Our area agencies on aging are doing a lot of work with that. So is the Vermont Department of Health. But there's no reason for people to be falling and getting hurt and becoming incapacitated. So that's an area of focus. And the last one that I think is a real concern to us, where we're much higher than the national average, is in our death by suicide rate for seniors. So when we think about isolation and how that might contribute to loneliness and depression, it's something that we must focus on. It's something that we can do something about. I guess the only other area I would really mention is that, the rate of diagnosis for dementia, Alzheimer's, and other related disorders is increasing, and that's got a real impact on individuals, on their families, and on our healthcare system.
Now, Megan, can you give us a phone number if people have questions?
I can. That would be the senior helpline. That's 1-800-642-5119.
And I think it's safe to say there probably hasn't been a question that you can't answer. Thank you both for joining me today.
You're welcome. Thank you.
That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.